Hello, everybody. Welcome to the Pathway Programs, Building Your Resume with Education and Leadership Development. Today we are here with Cori Garcia-Hansen, who is the Center Director for the Area Health Education Center at the Whatcom College, which is responsible for improving the healthcare in rural and underserved communities. So today, Cori will let us know about the ways that you can strengthen your resume to one day become part of the healthcare workforce. And some just brief background, Cori has worked in rural communities, immigration law, agriculture, primary care, and all parts of healthcare. And she has background in teaching and developing curriculum and 10 years of experience working in clinics and health centers. And with that, Cori, please take it away.
Thank you so much, Joe. Yeah, so this is going to be a little bit high level, but I just want to get you kind of accustomed to some of the different types of programs that are available in the state and how to find them and how to kind of take some of those initial steps to kind of figure out what might be a great way to get started in developing your resume through some education and leadership building programs. So just to give you a sense of kind of where I'm coming from, where I'm at. Like Joe mentioned, I work at the Area Health Education Center. I'm trying to get my slide to move forward. There it goes. And the purpose of an AHEC program, as we refer to it, is to develop and enhance education and training networks within communities, academic institutions, and community-based organizations. So what does that mean? That means that we do have some programming where we offer direct trainings or workshops, but we mostly work with a wide variety of partners across the state who have similar goals as we do to help kind of elevate everybody's work and to help direct students to more resources as they develop professionally. And so essentially, you know, what an AHEC is that we're part of this large federal public health service grant. And our main grant that makes us an AHEC is through the Health Resources and Services Administration. And that's part of the Health and Human Services Administration, where maybe like through the pandemic, you've kind of seen that department being highlighted in some of the information about how we were developing programming to serve people through the pandemic. Well, so I work underneath that department through a grant. And we are basically a public health center that's focused on building these training and education networks. And the purpose of that is to improve the equity and access to health education, the quality of healthcare and diversity in the healthcare workforce, and to create a healthcare workforce that's responsive to the rapidly changing environment that healthcare is. We call this practice transformation. And we focus on rural and underserved areas, or what sometimes people refer to as the healthcare safety net. So our programs help to increase diversity among health professionals. We broaden the distribution of health professionals where there's shortages. We enhance healthcare quality and improve the healthcare delivery system through our trainings. It's kind of a tall order and we do our best to fulfill it. But that's what AHECs are for. And they're all across the country. So essentially the way this works too is that we really will work with you throughout your whole professional development. So we help you at this stage, like these types of programs, with helping to develop awareness and helping to prepare you for healthcare. Then once you're in a health education program, we have some complementary trainings that we offer, in particular to prepare students to go to work in underserved communities. And I'll talk more about a little bit about what that is. And then some of that includes some immersion programs. So we work with different industry partners to place students in rural and underserved areas for experiential learning. We also are connected to other programs that provide scholarships. And then once you're a working health professional in an underserved community, we provide continuing education. We host webinars and workshops. We also create conferences and summits. And then we work with the national and the state loan repayment programs. So after this, my next session is going to go into more detail about those scholarships and loan repayment programs. And we also work with a National Institute of Health grant that's working to expand diversity in research. We do some work there right now that's focused around providers. There aren't opportunities for students that are younger than 18, but once you're a working health professional, we have some opportunities there. And then lastly, once you've been working for a while, or just feel ready to kind of get back into service, even as a student, we have opportunities for people to be preceptors or mentors or give presentations. So you may have seen that, on the first day we had an AHEC scholar, Alex Rodriguez, that presented. He's in one of our programs. And then yesterday we had two groups of students who are AHEC scholars who presented, and they're in our academic training programs. They're currently health profession students. But then, for some of those immersion programs where we need preceptors, we actively recruit physicians and nurses to take on students in rural and underserved areas and kind of give them like a month-long immersion experience there. So health careers. So one of the things that I like to highlight before I kind of get into some of the training programs that I think are helpful in developing leadership skills is just really the wide variety of options. I think sometimes when we're thinking about what we want to do for our careers, often we've only been kind of given a few limited options or ideas of what it means to work in healthcare. And there really is so many things to do. In fact, I never would have imagined that a position like this existed in healthcare, where I get to do all these different types of new programs and learn about all these different kinds of fields and work with so many different people across the healthcare sector. I mean, it's kind of a unique thing. So, first of all, why do we get into healthcare? So there's kind of really some different personalities that are excited about healthcare. I mean, certainly it's very fulfilling work, and some people have very strong, are caregivers by nature, are really passionate about social justice or community service. And healthcare can sometimes be a really natural place to fit into that, whether it's through those clinical positions or some of the administrative or public health. There's public health policy and other varieties of policy that's available, where you can be shaping the way that healthcare is delivered and how people access healthcare. Some of my colleagues work in the legal side of healthcare and kind of creating new laws, getting involved in kind of where there are huge cases going on in our legal system around healthcare, and protecting patient rights and patient advocacy. There's also really wonderful careers just working in community. And I'll highlight some ways in which you can kind of even just be involved in community health. You don't even necessarily have to have a formal position in healthcare to really make an impact in community. So, there's really wonderful opportunities to make a difference in other people's lives. Also in healthcare, there tends to be a little more above average earning potential, though, you really do want to watch some of the different opportunities in careers that come up. Be thoughtful of kind of what the cost of living is in your area and a given wage, and really advocate for yourself. Know that the skills that you're bringing to the table are valuable and you should be compensated for that. And I, of course, I'm very concerned about making sure we have enough healthcare providers who work in underserved communities. But that does come with challenges. And so you do want to make sure that you are, you know your value, and you feel comfortable speaking up for yourself, because it's important. And in healthcare, there are lots of options for work. And so know your value. And there's a strong job outlook. There is a lot of openings in healthcare. We have a very big shortage of really key health positions, and really all health positions across the board, whether it's clinical or administrative or on the side of IT or engineering. So lots of opportunity there. It's a stimulating work environment. I think you heard some of the folks talk about how you are constantly learning. In every field, there's always new development going on and new things to learn. And that can sometimes be a little intimidating, but it's kind of about your perspective. I think sometimes people feel like if you're going into healthcare, you've got to be like, super smart, and can sometimes get competitive about that and want to demonstrate that they're smarter. But really, I think some of our best healthcare professionals are the ones that are curious, want to work with others around them to learn and know their boundaries. They know when they don't know something, and you'll find that I think people really respect you when you say you don't know. I think sometimes, I think even when I was a student, I was afraid to say I don't know. So don't be afraid to say you don't know. In healthcare, often we don't know. And then there's opportunity to travel. You may have seen that with the pandemic. And sometimes with those travel positions, there are much higher wages involved with that. And really, we need you in every community. So just about anywhere you envision living, when you've been doing your envisioning exercises, you probably can find a job in healthcare there. There's very flexible schedules because healthcare is provided 24/7. But there are limited careers that are 24/7, and there are limited careers that sometimes are 8 to 5 if you really want to have some clear boundaries and set times that you want to work. Really look into kind of some of what if the training and work hours are for individual careers, and if that kind of meets like who you are as a person. And then again, there are just a huge variety of options available. So let's look at some of those, and then we'll get into the pathway programs. So this is a little chart that I like to use that just kind of demonstrates also just kind of the versatility of being in healthcare. So really, like if you are just a little unsure and you want to explore and try some of the more entry level positions just to kind of get a sense of what it's like, know that you can move on. But be thoughtful about when and how you use financial aid, when you use loans to develop your health profession career, and how many of the credits or trainings that you're paying for actually are transferable to other jobs. So it is possible to move quite, we sometimes even call this the health career, not a health career ladder, but a health career lattice, because you really can kind of go, kind of diagonal in different directions with your career in healthcare. And many people work in various sectors of healthcare throughout their whole career. But do be thoughtful of kind of your financial planning side. And there are many resources as well to help you with that. And we put that in the resource page as well on the platform. So I was going to talk about too, like, how can you make a difference in the community? Well, you saw Sophia showed this image about social determinants of health. So this is a popular way to kind of look at this concept of social determinants of health from the county health rankings model. And really conceptually, this idea is that really what makes a person and a community healthy is not so much the clinical care that we imagine. When we think healthcare, we think, well, that's kind of what makes people healthy. And really, it's all these other things that really make someone healthy. So there's also all these wonderful careers in kind of helping people with their health behaviors, whether that's behavioral or like more, directly, or kind of things like diet and nutrition and exercise, substance use, sexual health. So there's lots of ways to get involved there, whether it's like, again, direct in clinical care or as a health educator or a community health worker or in public health. And then education, employment, socioeconomic factors, kind of getting involved with all those things that kind of make our standard of living. You really are making an impact on people's health and wellness. So there's lots of ways to get engaged there. And some people who specialize in health policy sometimes get involved with some of these elements and how they impact healthcare, or do research and kind of looking at how these pieces of people's lives impact their healthcare. We're also doing a lot in healthcare right now directly in the clinic to actually ask people more questions about these things about their lives, to better understand all the different factors that are contributing to and sometimes harming them as far as their overall health. And then there's also environmental health and environmental justice it says 10%, but it's a big part of kind of what makes up some of these other things, right? So lots of ways to get involved and be a part of what makes a community healthy. And what are some of the places to work? So I mentioned the healthcare safety net. So what is that? Now, certainly you can work anywhere in the healthcare, and for area health education centers, we are much more concerned about the healthcare safety net. And what that means, the Institute of Medicine defines that as practices where providers who organize and deliver a significant level of healthcare and other needed services to uninsured, Medicaid, and other vulnerable populations. So basically, these are like your rural health clinics, your community health centers, your critical access hospitals are some of the classic ones, migrant health centers, and you can see some of the other ones noted here as well. Really, the healthcare safety net is really this huge network of different kinds of facilities that provide a wide variety of services to this population that I'm talking about. Okay, so let's get into these pathway programs. So one of the things that AHEC is doing to try to help with bringing out or sharing more information about this huge network of pathway programs, as I like to call them, and education, health profession and education and training programs, is to put them all in one place. Now, this is a much more complicated undertaking than you might imagine, and that we're actually been building this website from scratch, working with students and interns at the University of Washington's informatics program and the University of Washington School of Medicine, as well as a wide variety of other volunteers who we work with through an organization called Democracy Lab, where IT specialists and engineers, primarily in the Washington area, but actually internationally, donate their time to nonprofits to be able to develop programs like this. And there are IT people who have a special place in their heart for healthcare, and this is how they contribute to their community to make it a healthier place, is they donate their time for programs that are working on these types of topics around healthcare. So basically what they've helped us do is we've been collecting all this information about programs, and then they're helping to create this interactive map and search engine. And the next stage of development is to create accounts where then you can save your favorites and start to check off the ones that you've completed. And then if you're working with like advisors or counselors along the way, you can say, well, I've done XYZ and I was thinking of doing this next. What do you think? And it's a great way for you to then be able to organize kind of how you're doing, how you're developing your resume. So what do these look like? So what we call health professions, education and training programs that you can find on the map are your classic academic health programs like universities and colleges. There are a variety of training programs around the state that you may have heard of throughout this training. There are also a number of other organizations that provide professional development training while you're a student. And so we're also offering those on the map. So sometimes you'll hear people also talk about pathway programs as pipeline programs, and we've kind of gotten away from that because of the negative connotations around pipeline and environmental health and what that means to certain populations. But basically, these are just programs that help you enrich your professional development, starting in awareness building and developing experience to decide which way you want to go in your career, to developing specific skills and professional development, all the way through like residencies and fellowships once you're postgraduate. So we have health career awareness programs, tutoring and skill building, college readiness programs, youth camps, work-based learning opportunities, certification programs, and even volunteer community service programs are what we're recruiting to put on the map. So when I say a healthcare awareness program, it's like one just like this, like Sound Careers in Healthcare. Sometimes they're hands-on, in-person, in simulation labs, academic institutions or industry sites. They can be career fairs and field trips and tours that occur throughout the year. Also, I know for many students, it's really important to connect into some tutoring and skill building. And so we're actively recruiting programs that are offering these services to students as well. And then another important element to kind of helping support you along your way, right? I mean, just getting to like a doctorate program, you're going to have to apply for a wide variety of programs and get through interviews and kind of understand what are the components and pieces of developing that application and any pre-testing you need to do. So there are a variety of programs that help you prepare for that. There's even folks who host mock interviews to help you practice your interviewing skills and help you write your applications and personal statements and essays. Then there's kind of classic youth summer camps and seasonal camps during school breaks that we are listing on the map. And then there's work-based learning, like some of the things you've heard about apprenticeship, internships, and shadowing. These are hard. The internships and shadowing can sometimes be harder to get, but like our colleagues at Eastern Washington AHEC, they do have internship programs and shadowing programs where we work with industry partners to give students a summer job, essentially doing that work. And then once you kind of get to your postgraduate time, especially for like physicians like medical doctors, they need to do residencies, and many of them will also do fellowships to develop their specialty areas. And we've been working with community health centers to get the wide variety of residency programs on the map for you to be able to track and kind of map out. So these are exactly the tools you need to kind of like do that envisioning and map out kind of the programs that you need. And then last, we have mentorship programs as well. So some of the things you could be doing this summer are some really basic things like mental health first aid. There are a wide variety of free mental health first aid trainings. Area health education centers offer these. You can do first aid and CPR with American Heart Association. If you may also be able to find a bloodborne pathogen or HIV. These are great things to have on your resume when you apply for any job in healthcare. There's also really great resources through organizations like Crisis Connections, who do community trainings on suicide prevention, de-escalation training. Some of these things can also, you can end up doing jobs where you work at a crisis center or hotline, which is a very rewarding job and really exciting. There's lots of training that comes with it. And then at some of our colleges, our community colleges, they offer a wide variety of individual training programs that you can also stack that then become either a larger certificate or an associate's degree. So contacting your local community and technical college to find out kind of the different opportunities that they have in allied health training can help you kind of build a resume with some shorter trainings that maybe only are a quarter or a month long. So definitely go to your community technical college to look for some great opportunities for short trainings. And then lastly, we do work with some service learning departments, and they have been cataloging over the years varieties of ways to work in community service. And I know for some students too, that's a requirement. So, AHEC has some information about that too, if that's something you need. So I'm just kind of concluding here. These are some resources that are available on the Cadence platform on the resource page. But I wanted to highlight these and kind of starting with kind of looking at kind of doing the survey at CareerBridge to see kind of what might be a good fit for you. We have a guide called Directions to Healthcare Careers that will give you kind of the rundown of like, how much do you make? Where do you go to school? What does the job look like? And then this is that Health Career Path project that I was just showing you with all those great programs. Right now we have 77 programs listed, and we're about to launch a major effort to expand the programs listed there. Some people don't know that the Washington Student Achievement Council is the great place to look for scholarships and information about loan repayment in the state. And I'll be talking about that a little bit more in my next session. One of the other sessions here today that's being recorded is the Washington Opportunity Scholarship, which is a great resource. And then on our website itself, there is a whole page devoted to student resources, like I've been talking about. And I also just wanted to give a shout out to the College Success Foundation. They're a wonderful resource. They have offices across the state, and they can connect you to a lot of those, especially the opportunities to prepare for college and college application writing, as well as connecting you to tutoring resources and events like these. They are often a partner in a wide variety of career development fairs. So here's my contact information and our website where you can get connected to all this information. So I think we don't have a whole lot of time for questions, but I don't know if there are any.
Well, thank you so much, Cori, for talking about all the resources available for students. And I'm also amazed at the amount of support there is. Well, as we're waiting, one question I had was, you were talking about the variety of healthcare professions from policy work to community work. And as a high school student, how can one find their niche with so many professions to choose from?
Yeah, I think it just comes down to kind of, I guess, at least what personally, I think it's important to kind of follow your heart. So if you have an area that you would do without being paid, like something that you really love doing, that you wouldn't care if you got paid to do it all day long, that is a good direction to go, And I think sometimes we feel limited, certainly by, resources and time and maybe other factors or responsibilities in our lives. It may be a longer journey because unfortunately we do have sometimes some barriers in the way our systems are set up. And I guess take hope that many organizations like ourselves are working on eliminating those barriers. But the reality is that it is harder for some. But I think that there are so many people who have kind of stuck with it and kind of continue to follow what they know is true about them in their heart, and know that your first career that you do doesn't necessarily define you. Know that the first thing you do out of high school doesn't say what you're going to do for the rest of your life. And that any of life event that happens along the way also, hopefully it's something that, you can transcend. I think always kind of keeping your vision on the future, kind of like what we've been talking about, envisioning your future, and keep driving forward. And really, you can kind of do any of these things that that is there in your heart, those things that you would do if no one paid you. I've been surprised. Like, I felt like there were times when I saw other friends growing up and I was like, okay, buddy, sure, you're gonna be a video game developer. And sure enough, that's what they do. I was like, you're playing video games all day long. And I'm like, I'm not sure that, that's a good use of your time. And now that's what they do. And they make good money doing it.
Totally.
And like some of my colleagues too, were really passionate about other fields of IT, and like in healthcare, there is a huge need for informatics specialists and programmers. Artificial intelligence and engineering and life sciences is exploding right now.
Mhm.
There is a lot of really exciting work happening in robotics and in coding and programming. So, there's just so many ways to go. And I also once I got into working in healthcare, I never imagined how many different ways there were to work in clinical care too, and work with patients. So even if you get into it and you say, oh, this blood and guts thing isn't really my thing, there's so many different ways to work with patients. So keep pushing forward and reach out to organizations like AHEC, and we'll help you with that.
Well, Cori, thank you for that answer. Great advice, not just for finding a career, but good life advice in general. We have a comment. Thank you, Cori. This is very helpful. Students, don't forget to have your feedback for this session. And once again, thank you so much, Cori, for your presentation. Super helpful.